Welcome to the CAT Tourniquet video tutorial, one-handed application to upper extremity. Insert the wounded limb through the loop formed by the band. Apply tourniquet proximal to the bleeding site. Pull the band tight and securely fasten the band back on itself. Adhere the band around the limb. Do not adhere past the rod clip. Twist the rod until bright red bleeding has stopped and the distal pulse is eliminated. Place the rod inside the clip, locking it in place. Check for bleeding and absence of distal pulse. Adhere the band over the rod, inside the clip, and fully around the limb. Secure the rod and band with the strap. Prepare the patient for transport and reassess. Welcome to the CAT Tourniquet video tutorial, application to lower extremity. Route the band around the limb and pass the red tip through the inside slit of the buckle. Pull the band tight. Apply tourniquet proximal to the bleeding site. Pass the red tip through the outside slit of the buckle. The friction buckle will lock the band in place. Pull the band very tight and securely fasten the band back on itself. When the band is pulled tight, no more than 3 fingers will fit between the band and the limb. Twist the rod until bright red bleeding has stopped and the distal pulse is eliminated. Place the rod inside the clip, locking it in place. Check for bleeding and absence of distal pulse. If bleeding is not controlled, consider additional tightening of the tourniquet or the use of a second tourniquet, side by side and proximal to the first, to eliminate the distal pulse. Secure the rod inside the clip with the strap. Prepare the patient for transport and reassess. Record the time of application. For more information about the CAT Tourniquet or any NAR products, please visit www.narescue.com or call 888-689-6277.
When you receive the tourniquet, the way it is packaged is for one-hand application, only going through the inside loop of the buckle. When it's removed from the pocket or from the vest, it's easily slid on top of the arm and then tightened down from this point. If we're going to put it on our own leg or on a victim's leg, we need to make sure that we go through both loops of the buckle to hold the amount of pressure needed to stop the bleeding in that leg. We want to put these tourniquets on high and tight each and every time, regardless of where the wound is. We used to be taught that tourniquets were to be applied 2 to 3 inches above the wound. And with the wartime now, we've learned a few things where that doesn't necessarily work all the time. Your arteries are lined with muscles and therefore are under a little bit of tension. And if that artery or even if the vein gets completely severed, can actually draw back up into the tissue. And so we want to make sure that we get as high as we can on the extremity. If we're putting it on the arm, we want to put it right here at the top of the shoulder as high as we can, or in the leg right up near the groin as high as we can on the leg. If the artery is severed and actually draws up into the leg and we put it down lower above where the wound is, we could still have massive amount of bleeding above where the tourniquet's being applied. So again, no matter where the wound is, on the arm or on the leg, put this tourniquet on as high as you can and tighten it down until all bleeding stops. Damage to the arm or leg is rare if we leave the tourniquet on for 2 hours or less. Often in the battlefield or in surgical procedures, a tourniquet is left on from anywhere from 6 to 10 hours with little or no side effects afterwards. In the face of massive extremity hemorrhaging to the arm or the leg, it is better to accept a small risk of some kind of side effect or damage to the limb than it is for your casualty to bleed to death. As the tourniquet is on somebody and the blood pressure starts to even out throughout the body and starts to rise now that we've stopped this massive bleeding, we may get some rebleeding at the site. If that happens, we can undo the windlass strap, we can tighten it up a few more times until all bleeding is stopped again, and then we can re-secure it. Whatever you do, we do not want to remove the tourniquet once we have put it on. It's okay to tighten it to get bleeding to stop again, but once it's on, do not remove it. If you decide to practice with your tourniquet, we need to make sure that we package it back up in a way that everyone is going to be comfortable with using. It may not be you using your tourniquet, so we want to make sure that we're all packaged about the same way so it's very quick and easy to apply. To repackage it, make sure that we undo it and stretch out the material to its full length there. We will put it through just the inside buckle. Only through the inside buckle. About 7-8 inches of material out and Velcro it down. Holding the windlass at the top and the clip, we will then fold it in half back onto itself. And like I stated before, this is how the tourniquet comes packaged. When we package this up, we want to make sure that the white windlass strap has enough of a tab to grab onto when needed, but doesn't cover the whole channel so the windlass can't get into the clip. On the back, we have a red tab to easily identify where the end of the strap is for tightening. The red tab can also be folded in to create a bigger tab to grab onto, whether you're using gloves to grab onto that. And so it's your choice. But when we fold these up into our pockets, we want to make sure, one, that they're out of the plastic that they came in, and two, that they're packaged about the same way. Remember, we want to put these on high and tight each and every time. For police officers that will be carrying this in their vest or in their cargo pockets, we want to make sure that we can put this on in as little as 20 to 30 seconds. If you're going to practice with a tourniquet you are actually going to be carrying, we can go ahead and practice with it, but don't tighten it down all the way. We don't want to stress the material and then depend on it to save our life later on down the road. Remember, we tighten these down until all bleeding stops, until there is no distal pulses in that extremity, and remember, train and practice as much as possible.